Canada's chief public health officer says we are in a very tight race between vaccines and variants of concern.
It is still too soon to relax measures.
Dr. Theresa Tam says with variant cases rising and until vaccines have us better protected, COVID-19 safety measures need to be strengthened.
Current community-based public health measures will be insufficient to control rapid growth and resurgence is forecast.
She points to the experience of European countries where stronger measures like lockdowns have been needed to control epidemic growth driven by variants, offering the example of the UK where strict measures have been kept in place until vaccines reach a majority of the population.
They are only beginning to ease restrictions very gradually, now that over 50% of the population has received a first dose.
She says recent declines in Canadian cases and severity indicators like hospitalizations and deaths have begun to reverse and are now rising. Over the last 2 weeks, Dr. Tam says case counts have jumped up more than 30% and continue to rise, with variant of concern cases rising rapidly in parts of the country, including Ontario.
More contagious variants like B117 can result in a rapid spike of cases.
Dr. Tam says the B117 variant, first identified in the UK, now make up 90% of all variant cases in Canada. She says Ontario's experience with variants substantiate the greater transmissibility and more serious outcomes seen in Europe.
60% increase in risk of hospitalizations, 100% increase in admission to ICUs, 60% increase in the risk of death.
This new modeling shows Canada's total COVID case count could pass 1 million by next week. And while cases in older people are declining thanks to vaccine prioritization, people aged 20 to 39 now have the highest incidence rate, which she says leads to concerns about greater spread.
Circulation of COVID-19 in younger, more mobile and socially connected adults present an ongoing risk for spread.
Dr. Tam says each new case in Canada is now spreading the virus to more than one other person, and that has brought this pandemic back into a growth pattern.